Think cholesterol is the enemy? Think again. For decades, we've heard a simple story. High cholesterol equals heart attacks. It sounds scary, and it drove major changes in diet and medicine. But between the headlines and the science, many myths took root. This documentary unpacks those myths, shows the real science, and gives practical steps you can use to protect your heart with clarity and calm. First, a relatable story. Meet Anna, a 48-year-old teacher who was told her cholesterol was high. She swapped butter for margarine, cut eggs, and stressed over labels. Yet her energy dropped, and her hunger never left. She wondered, did she fix anything at all? Anna's experience is common. Confusion about cholesterol often leads to fear and poor choices. So let's step back and define what cholesterol actually is. Cholesterol is a waxy substance your body needs to build cells, make hormones, and produce vitamin D. Your liver makes most of it. Some circulates in your blood attached to carriers called lipoproteins. That's where terms like LDL and HDL come from. LDL often gets labeled bad, and HDL good. But that oversimplifies things. LDL has important roles, and HDL is not always protective on its own. We need context. Particle size, inflammation, and metabolic health shape risk more than a single number. Now the myth-busting begins. Myth 1. Eating cholesterol raises your blood cholesterol a lot. The truth is, you and I respond differently. For many people, dietary cholesterol has a modest effect because the liver adjusts production. Eggs, shellfish, and lean meats can be part of a healthy diet for most people. Myth 2. All LDL is the same. Fact: small dense LDL particles are more atherogenic than large fluffy ones. Tests that measure particle number or size give better insight for some patients. Myth 3. Low cholesterol always equals better health. Low cholesterol can be a sign of frailty, malnutrition, or other health problems if it's very low. We don't aim for zero. We aim for balanced, personalized targets. Myth 4. Statins are always harmful. Fact: for people with established cardiovascular disease or high risk, statins reduce heart attacks and strokes. Side effects exist, but many people tolerate them well. Decisions should be individualized with a clinician. Myth 5. Natural remedies always work. Supplements and fad diets can help some markers but are not guaranteed substitutes for proven therapies. Science, not marketing, should guide choices. So what should you focus on? Shift from single-number thinking to overall metabolic health. Reduce chronic inflammation, improve blood sugar control, and encourage healthy body composition. These changes often improve cholesterol profile and lower risk. Actionable advice: prioritize whole foods, vegetables, fruits, legumes, nuts, and fatty fish. Choose unsaturated fats like olive oil and avocado. Keep processed and inflammatory foods minimal. Strengthen your routine with regular physical activity. Both aerobic exercise and resistance training help lipid particles and insulin sensitivity. Sleep and stress matter too. Poor sleep and chronic stress drive inflammation and metabolic dysfunction. Regular sleep and stress reduction practices like mindful walking or gentle yoga support heart health. Know which tests to ask your doctor for. In addition to total and LDL cholesterol, consider non-HDL cholesterol, ApoB, or an LDL particle test if you have risk factors or family history. Understand absolute risk. Use long-term risk calculators and discuss personalized thresholds with your provider. When medications are recommended, ask about benefits and risks in your personal context. Empowerment comes from knowledge and action. If you're worried about diet and lifestyle, start with small, sustainable steps. Swap refined carbs for fiber-rich alternatives, add 2 servings of fatty fish weekly, and include resistance training 2 to 3 times a week. Track progress with symptoms, energy, and evidence-based tests rather than panic over a single lab value. Remember Anna? She returned to balanced meals, prioritized sleep, started walking with friends, and measured progress with a clinician. Over months, her energy returned and her lipid profile shifted in healthier directions. She learned that clarity beats fear and small, consistent changes matter. In closing, cholesterol is not a villain to be eradicated, but a marker to be understood. Know the myths, demand good testing, and take steady, evidence-based steps to improve metabolic health. Talk with your healthcare provider about personalized targets and safe strategies. Your heart responds to patient, persistent care. Follow for science-backed tips and share to help someone rethink cholesterol today.